we do this workshop every month. And, we do it to be able to create an awareness, health awareness, because the big thing that healthcare always leaves open is awareness. We don't create enough awareness. When the patient walks through the door, we treat the patient, and the patient goes home, and we tell the patient to come back if it gets worse or whatever, give the patient medication and other conservative treatments or surgical treatment, but we don't create awareness to talk about these diseases ahead of time. So what is SDG3 Global Health Initiative? It is an affiliated health organization that is affiliated with UNESCO Center for Peace, which is a flagship member of the US Federation of UNESCO clubs, centers, and associations with a status in ESPER. So what we do, SDG3 promotes the SDG3. There are 17 SDGs that were marked by the United Nations in 2015. Now, out of those 17 SDGs, SDG3 Global Health Initiative is more interested in promoting the special interest of good health and well-being. And that's because we believe that a good health amounts to the greater entails of every other thing. If you're healthy, like right now, I'm not really healthy, but I'm strong. But if you're healthy, we believe you can do greater things. Other things on the list of the SDGs are education. Someone who is not properly healthy cannot be educated. Your sanity, your mental status is not going to be intact. Therefore, a lot of things will be affected. We have climate change. We have environmental changes. We have poverty. We have, food. But we believe that health is the mother and the branch and the roots branch that holds all of the other SDGs. That's why we have a special interest in promoting the good health and well-being. And in this particular organization, we do, like I said, monthly creation of health awareness, which we do monthly, regardless of the population. There's everything for everybody, we believe. Our first workshop was last year, December. We talked about diabetes awareness and food care, because diabetic patients have a lot of food care problems. We spoke about, we've talked about obesity and nutrition. We talked about cervical cancer. And this moment, we're talking about hypertension and stress management. Down the line, in 3 weeks' time, we're going to be talking about creation of mental status and all of that. So all of this is to be able to create awareness. We don't only believe in treating patients, we also believe in creating awareness. Talk to me about something that my doctor would never want to talk to me, because my doctor has a limited amount of time with me because he or she has other patients to take care of. Also, in this particular organization, because we are affiliated with UNESCO Center for Peace, we do partner with UN platforms, and we use their platforms for our own betterment. We also have an external groups that we partner with. Like right now, I'm working towards partnering with Commonwealth Health for something we will do. We do medical missions, although we haven't traveled yet because of COVID, but we've done within the local, we've done some things. And hopefully by this year in November, we're gonna be going to Nigeria. We're gonna be doing some diabetic awareness creation, and also checking of sugar level and checking the food care of those who are diabetic already. We do partner in the local and both international and national level. Also, UNESCO Center for Peace gives us their platform to use their delegates for their winter and their summer programs every year. So the delegates come together and we teach them and we groom them on healthcare, essential healthcare skills, and how to be the promoter of health community medicine in their various communities. One we already did in their winter program. We had a winter program which happened in February. We have two of our team members. We have student Dr. Hadima, and we have our public health practitioner Adeze, who presented, and their presentation was amazing. We actually got a job during that presentation. And we have another, like I said earlier on, we have a summer program coming up soon. So this is what we do here. And we just got started like last year, October, and we've been doing great so far. So thank you so much for joining our workshop. Thank you for answering our invitation, and we hope you get to learn one or two things after today and after hearing from our incredible presenters. Thank you so much for also our incredible and hardworking moderator, Dr. Julie, who left everything. Thank you once again, our special guest, and we hope you enjoy the rest of our day and your day as well. Thank you.
Wow, thank you so much, Dr. Noblin Ngozi Ogbonna. Welcome, everyone. My name is Dr. Juliet Offiah. I'm a medical doctor here in Nigeria. I hope you can all see me. Thank you so much. We have 13 people in attendance. Today is going to be absolutely amazing. I'm so excited to be here and super honored to be, taking this platform to talk to you about this very important topic. SDG3 Global are doing so many amazing things. I mean, based on the last time that I was here on the platform, we learned so much, and I'm so excited that we have a lot of people in attendance today that would gain from this experience. So if you'd like to have a question answered during the course of the presentation, feel free to type in your questions. We'll be having two sessions. The first one will be on hypertension, and the second one will be on stress management. So during the course of the presentation, if anything is striking to you, if you have a question, please type it in the chat, and I'll be able to address it at the end of the presentation. So if you can hear me and you can see me, please type a Y in the chat so that I'm sure that we are all together. If you can hear me and you can see me, please type a Y so that I'm sure that you are all familiar with. Oh, fantastic. Thank you so much, Miriam. Thank you so much, everyone, for being on this platform. I see your acknowledgements. Thank you so much. So without further ado, we'll be starting off with the first topic, okay, of concentration, and that is hypertension. So hypertension is really, really a global challenge. We have, in a population of 972 million people, we have over 29% as a burden in the scope of the 2020s. That means before we hit 2025, we'll be having that burden for us to deal with. So it's very important that we know how we can manage it. What are the things that predispose people to hypertension? What are the new things that you can even apply to your own life or somebody that you are close to help them to manage the condition, okay? And we have specialists that are going to be taking that topic right now, and we are very excited because everything that you're going to take from here is going to be something that is going to equip you, okay, as a person. SDG3 Global is all about wellness. It's all about, you taking care of yourself better. And what's the better way to do it than you knowing exactly, knowing more about health? Because when you do know more, you know how to take better care of yourself. So the first person that would be going up for this presentation, all the way from Malawi, she's a sweetheart. She's somebody that has worked very hard to put this slide together, and I'm very excited that she's going to be starting off. And remember, like I said, if you have questions, put them on the chat and I'll be able to address them, okay? She'll be talking about hypertension. She's a SDG3 Global Health Representative, okay? And she is also the founder of Phokera Health Initiative, okay? Yeah, I hope I got that right, Phokera. And she'll be taking hypertension with Dr. Atupele Zamba. You can unmute yourself.
Hi, Dr. Julie and everyone that's present. Thank you so much for having me. And I'm really looking forward to having this conversation about hypertension. So it'll basically be hypertension in 15 minutes, everything I can tell you within those 15 minutes. And I look forward to your questions and comments in the end. So let me share the screen.
Perfect.
All right, great. So the first question would be, I guess, in presenting about hypertension is what exactly is hypertension? So hypertension doesn't have a definition on its own, but it can be characterized as the blood pressure of a person that's 140 over 90 millimeters of mercury. When we say the blood pressure, we mean the rate, the pressure at which your body, your heart is pushing blood throughout your body. So the pressure at which the blood is moving and circulating throughout your body. So if this pressure is over 140 over 90 millimeters of mercury, which is the measurement that we use on 3 different occasions on 3 different days, we can classify you as a person that has hypertension. So there are different types of hypertension and different stages in hypertension as well. So what are the different types of hypertension and what are the different grades involved in hypertension? Because it's not just one broad, oh, this person has hypertension. The stages help us in treatment, they help us in controlling the disease, they help us in understanding the risk factors of the disease as well. So the optimal blood pressure for anyone is a systolic blood pressure of 120 over 90, or 80 rather, in different countries, but yeah, 120 over 80. If your blood pressure, if you go to the clinic and your blood pressure is 120 over 80 or slightly lower than that, 110 over 75 or anything like that, you're in the good. The minute we start to get worried is once it starts going over 130 over 90 or anything above that. That's when we start to get worried. So we have pre-hypertension, which is, oh, sorry. My presentation is going rogue. So we have pre-hypertension, which is when a patient has a blood pressure of 120, higher than 120, but less than 140 systolic, and then the diastolic pressure being 80, but less than 100 systolic. So that is in the case where you'll have pre-hypertension. Moving on to grade 1 hypertension, which is 140 to 160 and 90 over to 100 diastolic. So as you can see on the table, it quantifies the different levels and the different grades of hypertension, so that you can understand. Once you hear your number, once you go to the clinic and you hear, oh, your BP is 160 over 100, then the alarm bells can start ringing in your head and you're like, oh, that's a little high. And then you won't be completely confused as to what exactly that means. You're like, oh, is that okay? Is that not okay? So this is like a quick guide as to the different levels of hypertension, the different grades of hypertension rather, and what they mean. So hypertension is actually called a silent killer because a lot of people who have hypertension don't even know that they have it. It's very prevalent in the world. According to the WHO, 1 in 5 women have hypertension. 1 in 4 men have hypertension. So if you're in a room and you're 5 people, there are 5 women. 1 in those 5 women probably has hypertension and most likely does not know about it. If we look at the side of the prevalence of hypertension based on region, you see that the highest prevalence of hypertension is in the Eastern Mediterranean. Oh, sorry, it's in Africa actually. We have a lot of cases of hypertension here, mostly uncontrolled, unfortunately, due to some other factors that we'll discuss at the end. Seconded by Eastern Mediterranean, then Southern Asia, Europe, the Western Pacific, and lastly, the Americas. But as much as 18% might sound, globally, as much as 22% might not sound like a lot of people if you consider the whole population of 7 billion, 22% of people having hypertension is actually a very big number. And it's it's a big problem that we need to pay attention to and need to do the best we can to control it as well. So on that note, what causes hypertension? If we think about the causes of hypertension, it will also lead us to classifying the different types of hypertension. So the most common cause of hypertension, or the most common type of hypertension rather, is essential hypertension. This is what others may call primary hypertension. And this actually is 95, sorry, this actually incorporates 95% of the cases of hypertension globally. And that means that 95% of the cases of hypertension have an unknown cause. It is not known why these people have developed the hypertension. It could be genetic, it could be hereditary, but it's an unknown cause. Now, secondary hypertension is where you can trace the amount of people that have, you can trace the reasons that the people have hypertension. So this is actually only 5% of the cases of hypertension that are presented to us where we can trace why the patient has developed the hypertension. And these causes of hypertension and the secondary hypertension are mostly caused by renal diseases like glomerulonephritis, endocrine diseases, Cushing's disease, and other diseases that can develop in the body like coarctation, pregnancy, steroids. I won't get too technical because I know you might be like, what is she talking about? So these are just some examples of some of the secondary causes of hypertension. In that, you also see in the picture on the side that stress is one of the causes of hypertension, and that is why we have merged this presentation to be hypertension and stress management, because stress is a big contributor to hypertension, especially in this day and age of COVID-19, where you have a lot of people that are stressed out in general about their relatives, about quarantine, about all the different things that are going on in the world. It's caused a high spike in hypertension. So it's important to understand what hypertension is and to relate that to stress and stress management as well. So on that note of the causes of hypertension and hypertension itself, what are the symptoms that you can see in yourself? What should make you feel alarm bells? What should make you think, oh, okay, so this is what's going on with me. Maybe I should go and get checked. Maybe I should get my blood pressure checked. You have fatigue, severe headache, vision problems, difficulty breathing, chest pain, pounding in your chest, neck, or ears, irregular heartbeat, or blood in your urine. And if any of these things present themselves to you, you should definitely think, okay, I need to go to the clinic. I've been stressed lately, or I've not been taking care of myself. I need to go and get myself checked. Because hypertension can lead to a lot of end organ damage and can lead to a lot of other complications. As much as these symptoms can present themselves, though, it's important to remember that I did mention that hypertension is called a silent killer. So in a lot of cases, you won't even have any symptoms. You won't even understand that something's going wrong until further along in the disease when you have some end organ damage or anything like that. So, but in the case where you do have these symptoms, please do go and get checked. In addition to the signs that I just mentioned, it can also lead to kidney damage, chest pain, sleep apneas. Basically, hypertension, increased blood pressure can lead to end organ damage. So in this case, you should consider the fact that it can lead to damaging any part of your body because blood goes everywhere. Blood is what supplies everything in your body. So if you have increased blood pressure, it can lead to a damage in any part of your body, sensibly so. So these are the signs that you should look for. You should be worried about, and you should keep in mind for anybody near you or for yourself. And if you do exhibit any of these signs or symptoms, please do go and get checked and get your blood pressure measured. So once you go to the hospital, they've tested you the first time, your blood pressure was high. You've gone back again, your blood pressure was high again. You've gone a third time, your blood pressure was high again. So what's the doctor gonna do now? So these are some of the tests that the doctor might run. And I'm mentioning them so that you shouldn't be alarmed. like I mentioned, there are secondary causes. So really, we're trying to see if we can find out what is causing the hypertension. So the doctor will probably do blood tests to check your kidney function, because renal disease is one of the main causes of hypertension, of secondary hypertension. They'll check your random blood glucose, because diabetes is related to hypertension. They'll do a renal ultrasound to check your kidneys again. And another important test, which is, I think, primarily done in the Western world, is the 24-hour ambulatory BP monitoring. So I don't know about my friends in Northern Africa, but here in the South, we don't really do this one, but it is very important. So the doctor will give you a device that will measure your blood pressure and keep a record of your blood pressure for 24 hours. This is important because some people have what is called white coat hypertension. So this is when a patient, or a person, will see a doctor and their blood pressure will just rise. They just see a doctor and they get stressed and their blood pressure rises, but they're not actually hypertensive, excuse me. So the 24-hour ambulatory BP monitoring allows us to just evaluate how your blood pressure was throughout 24 hours. And then we can see, does this person really have hypertension? Is their BP really high, even when they're not in the presence of me, a doctor? So that's the 24-hour ambulatory BP monitoring, which is a standard in the Western world, I think. Before they diagnose hypertension, they will do the 24-hour monitoring. Then they'll also check the echocardiography. This is in line to see if there's any end organ damage. So if your heart is pumping hard and the pressure is high for a long time, it can cause strain to your heart. And so the echocardiography allows us to visualize the chambers of the heart and to see if there are any structural abnormalities that have developed as a result of the high pressure that has been moving throughout your body. Some other tests might be done depending on what the symptoms that have developed are, and trying to find a cause behind the hypertension. But these are the standard tests that can be done, that will be done, rather. So why is it important to test the hypertension, to know you're hypertensive, and to manage the hypertension? Uncontrolled hypertension causes premature death. It is a silent killer. The hypertension can cause an increased risk of heart attack, stroke, kidney failure, blindness, and other complications. Like I mentioned earlier, blood is basically what keeps us going, right? So increased pressure of blood can affect any system in your body, and this can have a this can have an effect on you that can lead to death. And it's one of the leading causes of premature death if uncontrolled. So it's important to understand what hypertension it is. It's important to manage your hypertension. It's important to do the things to avoid getting hypertension if you don't have hypertension, because there are certain risks that can predispose you to hypertension. Yeah, I think I mentioned some of them, and I will mention them again. So it's important to understand how important hypertension itself is, so that you can prevent the disease in your life and prevent premature death. So that brings me to the next point. Now, you've gone to the hospital, you've been diagnosed with hypertension, you are stressed out, and that's making you more hypertensive. Don't be stressed out. Hypertension is a disease that actually can be managed very well if the lifestyle changes that are told by the doctor are followed, and if the drugs are also being taken, it can be managed. So how do we manage the hypertension? And also, how do we avoid getting the hypertension if we don't have it? Management is based on the grade and the level of hypertension that you have. So if you have pre-hypertension, the doctor will probably just give you some lifestyle advice. If you have grade 1 hypertension, and you can see on my flow chart there the numbers that are the blood pressure that means grade 1 hypertension, like I mentioned at the beginning, the doctor will definitely give you lifestyle advice and will put you on drug treatment, especially with patients that are at high risk of cardiovascular disease or renal disease. If you have grade 2 hypertension, immediate drug treatment in patients, lifestyle advice, and aim for BP control within 3 months. Grade 3 hypertension, blood pressure that's over 180 over 110 millimeters of mercury, lifestyle advice, immediate treatment, and aim for BP control again within 3 months. So really, what is our aim when treating the hypertension and giving the advice to our patients? We're trying to aim for a BP that's less than 140 over 85 in patients without comorbidities. So what does this mean? Patients without comorbidities means patients who don't have any other diseases, patients who don't have heart failure, who don't have diabetes, any other renal failure, liver diseases. We're trying to aim for a blood pressure that's less than 140 over 85. In patients who are diabetics or who have renal failure or have heart failure, we're aiming for a BP that's less than 130 over 80. Because of course, these patients that have comorbidities have a higher chance of damage to their organs if the BP is higher. So we're aiming for a lower BP in patients with comorbidities. So what can we do? How can we prevent the hypertension? How can we prevent the high blood pressure, excuse me. Firstly, reduce salt intake to less than 5 grams daily. So salt is said to cause vasoconstriction in your vessels. So if your blood vessels constrict and become smaller in a smaller space, then the blood will increase the pressure. The pressure of the blood will increase. So reducing salt reduces vasoconstriction and reduces high blood pressure. Eat fruits and vegetables regularly. Avoid saturated fats and trans fats. Avoid tobacco. Avoid alcohol, and be physically active every day. And I'm sure these are all things that we all know. I'm sure these are all things we've not heard, not only from a doctor, but I mean, in today's day and age, I'm sure we know that we shouldn't eat fatty foods, we shouldn't smoke, we should reduce our alcohol, we should be physically active and eat fruits and vegetables for our health. More on those lifestyle changes, you can see this is the European Society of Hypertension's guide on the amount of exercise you should do, the amount of salt you should take, the amount of vegetables you should take, and also important to reduce your BMI, because obesity can also lead to hypertension. So we have a salt restriction of 5 to 6 grams per day, moderation of alcohol consumption to no more than 20 to 30 grams of ethanol per day in men, and 10 to 20 grams of ethanol per day in women, increased consumption of vegetables, fruits, and low-fat dairy products, reduction of weight to BMI of 25 kgs per meter squared, or waist circumference of less than 102 in men and less than 88 centimeters in women. Regular exercise, at least 30 minutes of moderate dynamic exercise on 5 to 7 days per week. So a 30-minute walk, just a 30-minute walk every day is a big difference to your life. And we advise you to quit smoking, or rather, I had a teacher of mine that once told me that if you tell a patient to quit smoking, they'll never quit smoking, but rather to reduce. So you can start with a reduction and hopefully lead to quitting altogether, because it's your life, you know? So what do we do in terms of medication? In terms of medication, now this is how we treat it here in Malawi and most of Southern Africa. We use a stepwise approach in which we don't give a lot of drugs at the same time. We start off with something we call a diuretic, which is usually hydrochlorothiazide here. I think in the West, I think in the Americas, you probably start off with an ACE inhibitor. So the first line is a diuretic hydrochlorothiazide. If the patient is a heart failure patient, you would rather start off with furosemide. There are the drug groups for the second line, the third line, and the fourth step. So we ensure that the patient has reached the maximum tolerated dose of the drug before moving on to the next step. or rather if the patient is not compliant, rather in the sense, sorry, not compliant, but if the blood pressure is not reducing after the first line, then you would add the second line and then move on to the third line. But the important thing about anything that a doctor does or says or gives you is that the patient needs to be compliant, right? If you have medication and your medication finishes, which is actually something we go through a lot here, you have patients that their medication finished 2 weeks ago, and then they'll come in hypertensive emergency, their blood pressure is so high. They'll be like, oh no, my medication finished. And then I thought, oh, I'll just go get it later. But with hypertension, it doesn't work that way. You have to take your medication every single day to control the hypertension. So that's, I think, the most important thing, drug compliance, making sure you take your drugs every day, making sure that you're doing the lifestyle changes, you're staying active, you're not smoking, you're eating healthy, and you are managing your stress levels. Thank you very much. I hope you were present throughout the presentation and nothing was complicated. And if you have any questions, please feel free.
Wow, thank you so much. That was absolutely amazing, concise, and you went straight to the point. So that is absolutely amazing. Thank you so much, Dr. Atupele. I'm sure you guys all got a lot from that presentation. I see you on the call. Welcome, everyone. If you have any questions, please, this is the time for you to type it in so that we can, okay. There, okay. So we have questions coming in and appreciation as well. We have Ngozi saying very succinct presentation. We have a question, okay, from Miriam, and she's saying, her question goes, are there medications that cause hypertension?
Okay, there are some medications that cause hypertension. Some over-the-counter drugs that can raise your blood pressure include like indomethacin, aspirin. These are all drugs that can raise your blood pressure.
Okay. All right, so we have another question. What is the relationship between diabetes and hypertension?
Okay, so with diabetes and hypertension, so one of the effects of diabetes, right, is that, like I mentioned, vasoconstriction earlier. So one of the effects of diabetes is it causes, there are several end effects of diabetes. It can cause polyneuropathy, and it has an effect on your blood vessels. So it causes the same vasoconstriction of the blood vessels, and it also damages your blood vessels as well. So once you have the damage to the blood vessels and the vasoconstriction of the blood vessels, this will in turn lead to high blood pressure.
Okay, awesome. So, so basically, as you're having the narrowing of the blood vessels is going to contribute to the hypertension that we are dealing with.
Exactly.
Sometimes
exactly.
I usually tell my patients that, when you have a tap and the hose, like the opening of the tap is really big, the water is going to probably just flow out, calmly. But if the tap is really, really small and you put it on, the pressure will be so hard. Sometimes you can leave an impression on the surface where that water is hitting for a long time. So the same thing.
Exactly.
Yeah, over time, that pressure, even if you put it on your skin, I'm sure it would, make you feel uncomfortable. So you can imagine, that is why we have people over time, they now eventually come up with end organ diseases, and like Dr. Atupele mentioned, okay? So we have more.
Yeah, and in addition to that, the diabetes causes something called atherosclerosis, which is hardening of the blood vessels. So any effect to the blood vessels, like Dr. Julie mentioned, will then cause the narrowing and the blood pressure, increased blood pressure.
Exactly. Absolutely. So we have another question, very interesting and very peculiar question. So I'm really excited about this. This one. It said, what do you think about herbal medicine treating high blood pressure.
Mm.
Because that one is, I mean, that and compliance, they're like brother and sister in my practice, like especially because of, you know, even in the Western world, some people do have their remedies and stuff like that. So
True,
yeah,
true.
so do you have anything to, say to that? So somebody that feels, okay, can something herbal help me in this situation? Because to be honest, sometimes some people, when they get this notion that, oh, when I'm hypertensive, I have to be on medication for life. So people are like, oh,
True.
so I would rather do something more natural and stuff like that. So what do you say to, such a person?
As a medical professional, I am inclined to say that you should take drugs, the correct antihypertensive drugs for the hypertension. But I will never knock herbal medicine altogether, because I know that there are some things that we don't know about, that we don't give. I mean, because we don't give a lot of attention to this, to the herbal medicines in Africa. And I won't say that altogether, oh no, these are all bad. You know, I'm sure there's some things out there that work for certain people, but I will always lean towards the actual antihypertensive drugs. So I know that's kind of a non-answer, but it can go both ways, I think. I'll never knock herbal medicine altogether.
Yeah, I totally understand what you are saying. You know, we are scientists, so we have to do things that are with clinical trials, things that are already proven. So we have the tests that can support the treatment that we give you. But when it comes to herbal medicine and stuff like that, we don't have the documentation. So like Dr. Atupele said, the documentation is not there. So maybe somebody can go into that venture and see if those things can help. But right now, the doctor is there to give you what is safe, okay, and globally approved. So it's better, we can't touch on herbal medicine or give any validation for those ones at this point. Then we have other questions, and we have another speaker in the house in case he wants to chip in and answer any of the questions. We have the MD of the King Central Medical Center in Ogun State, Dr. Akinkunmi, Akinlade. He's here. Let's just put him up because Dr. Atupele is doing such a good job. What if you can unmute yourself?
Okay, Dr. Atupele is doing a wonderful job. Hello, everyone.
She with a great smile. Thank you so much.
Thank
Welcome,
you.
Dr. Atupele.
Yeah, so feel free to.
Thank you.
Okay, so we have another question. Is there a relationship between having hypertension and being sexually active? Is there a relationship? Dr. Akinlade?
Okay, yeah. Thank you very much for that question. Hypertension does not cause, being sexually active does not cause hypertension. However, because of the exertion of the heart that occurs in sexual activity, sometimes people who have uncontrolled hypertension could have complications in sexual activity. So that is why we advise that everyone that have hypertension should actually get treatment, like Dr. Atupele said. So the answer is that while there is no direct connection between sexual activity and hypertension, people who have sexual activity and are hypertensive and are not regular on their medications can easily develop cardiovascular complications.
Absolutely. So thank you so much, Dr. Akinlade. So talking about developing complications, it kind of leads me into the next question, which is, can hypertension cause stroke? This person has like a three-pronged question, like, can hypertension cause stroke? What is your preferred antihypertensive medication? And what situation is screening for secondary hypertension important? So I think I'll give that back to Dr. Atupele. So that's, can hypertension cause stroke? What's your preferred antihypertensive medication, and what situation would you screen for secondary hypertension?
Okay, so hypertension is actually one of the leading causes for stroke. It's a very big risk factor for stroke. So what happens is, and we mentioned it earlier as well with the diabetes, is that when you have uncontrolled hypertension, it causes narrowing, it causes atherosclerosis and damage to your blood vessels. So those blood vessels include the blood vessels in your brain. So once you have atherosclerosis and narrowing of these blood vessels, it can lead to a high chance of a blood clot. And this can then lead to stroke or a transient ischemic attack. So hypertension is actually one of the biggest risk factors for stroke. And that's why a lot of people with hypertension, like here in Malawi, will automatically also give them aspirin. Sorry?
Okay. Yeah, that's the next question.
So yeah, we'll also, in addition to antihypertensive drugs, which here we'll start off with diuretics like hydrochlorothiazide and an ACE inhibitor like enalapril. We'll also, in addition to that, give them aspirin. So aspirin is an aggregant anticoagulant, which will help reduce the risk of stroke in that patient. But in terms of
having a bit of connection issue. So Dr. Atupele is frozen on my end. I don't know. Dr. Akinlade, can you hear her?
Oh, no, I can't hear her, but I can continue from where she stopped while we're waiting for her.
Okay, please go ahead.
Okay, here we talk about that.
Oh, wow. That's interesting. If you can hear and see me, please type a Y, because Dr. Akin is also frozen from my end. Okay. And if Dr. Akin is frozen as well, please type an A. Okay. All right.
Yes, they're having a technical issue. You can answer the question, Dr. Julie.
All right, let me go back up to see where we stopped. Sorry, just scrolling back up to the questions because we had a lot of why come in. All right, so what is it? All right, good. So the question where she stopped, I believe, was where she's talking about the situation where you screen for secondary hypertension, okay? Because we have the essential and then we have the secondary. Especially in cases where you have people that are having like comorbidities or risk factors, okay? Going back to the presentation that she had, because there are a lot of people that are prone, and it actually leads into another question that was asked here about, is there an age range where most people would have hypertension? Because the question goes that they've seen a 12-year-old have a hypertension before. So in the case of secondary hypertension, of course, we are looking at somebody that is an adult, somebody that is having probably a family history of hypertension. And apart from the family history of hypertension, chronic illnesses like diabetes, what do you call it now? Renal issues can predispose somebody to having a history of hypertension themselves and even developing those comorbidities themselves. So you want to make sure you screen for people like that. That's like a high risk situation, okay? Like we said, there is no known cause for hypertension. So everybody, we want to make sure we screen everybody. Something Dr. Atupele mentioned about having a 24-hour ambulatory BP check, okay? We do not do it here, but one thing that we usually recommend sometimes is we tell the patient to have their own blood pressure device, okay? We call it a sphygmomanometer, okay? So you can, even as an adult, and you are here on this call, if you have it at home, it is very, very important that you check your blood pressure in the mornings, especially if you are in your 40s. You want to make sure you check your blood pressure every morning, because yes, there is something called a white coat, hypertension. When you see the doctor, you panic. So you want to make sure you do the screening. For somebody that is like a teenager having hypertension, maybe the person there could be something like triggering it for the child, maybe like a renal issue, okay? We've seen kids that have like kidney issues that might have high blood pressure. We've also seen kids that are living with the sickle cell gene that can be predisposed to hypertension as well. Even those are the two main common ones, okay? And like we said too, sometimes some seizures can induce it. So it's very important that a doctor or a pediatrician should be involved in that kind of situation, like a particular age group. So no, so that's what I just answered. Yes, I've seen a child suffer a stroke, okay? I've seen a child suffer a stroke. So it can be that bad. What is the relationship between glaucoma and hypertension? Okay, so there's a question that says, what's the relationship between glaucoma and hypertension? So glaucoma is like, there's a very, very high pressure, okay, inside the eye, in a space in the eye called the aqueous humor. So it's like, sometimes I usually describe it to patients like it's like a hypertension of the eye. Do you understand? So it's most of the time, and Dr. Atupele mentioned this, that end organs get affected when you have high blood pressure, okay? So it's very important that even when you talk about total wellness of an individual, it's very important that you have complete assessment. I mean, if we do a poll now and tell people, how many of you have gone to have your wellness check? Some people will tell you that they've not done it in a while. And unfortunately, some people will also say that, oh, I've not done it in a while, and they feel like it is a good thing, okay? Or I've not been in a hospital in a while, it's a good thing. No, we've already mentioned on this talk that hypertension is a silent killer. It's one of the highest leading cause of death, where they don't know, there's no cause. Oh, after a brief illness, in quotes, we see that a lot in many obituaries, okay? It is very, very important that we go get ourselves checked. And I'm really excited because they are tying this to, stress. Stress is something that increases people's cortisol levels, and that can also move people to having hypertension, okay? And we'll be talking a lot about it on the call. So if you do have more questions, please put that on while we are trying to get our speakers back. I had a couple of questions myself, and I think they could be very enlightening. One of the things that I see, especially in these parts, okay, we have people that will be having challenges with what do you call it now? Compliance. That compliance issue is a very, very big issue. And that's one thing that we are trying to, address here. When you are well informed, you'll be able to know that this is something that it can happen to anyone. So you have the responsibility, okay? If you are going to do your lifestyle change, watch what you're going to eat, use, vegetables, eat more vegetables, eat more Mediterranean dishes, exercise, do your exercise 30 minutes, you can do it 5 times in a week. 30 minutes exercise 5 times in a week is something that is highly, highly recommended. And we have people that feel that, oh, I might not have the time. We have a lot of apps that can encourage you to do these things. There are so many. And one thing I want to advise people as well is that when you have to make sure whatever you are doing when it comes to exercise it's a prescribed exercise for you. I feel very sad when I see people go on walks or go jogging. They're probably having like pains, or they are too probably obese to have that kind of exercise. There are several other prescribed exercises that you can do for your own health status. So there are different exercises. So be very careful not to go for group, group engagements when it comes to exercising or trying to lose weight, or using dangerous diet to achieve it. Make sure you speak to a specialist to guide you on things like that. So, somebody is saying, can we mention some of the apps? We have so many. At least one that I would say that is free is Fit On. So if you can try that one, I have that also on my app. It's not, you don't need to pay for anything. You just have it on your phone. Fit On. You can see it's purple. Okay, you can have it on your phone. I think a couple of personalities came together to make sure people can have that and work towards. Somebody said Fitness Pal is great as well. So thank you. If you have any app that is working for you. I also have another one called 7, so you can use that one as well. So what are the symptoms for age of 30 and below? You know, like we were saying, thank you so much for that question. Like you were saying, thank you, John, for that question. We don't want you to wait for the symptoms to come, okay? We don't want you to wait for the symptoms to come. When you wait for the symptoms to come, it's probably too late, okay? So try as much as possible not to wait for the symptoms to appear before you now take action. But if you do have those symptoms, some people would feel like severe headaches. Sometimes if the headache is like one-sided, that is even like a red flag completely. So you can have severe headaches. Some people have fatigue, dizziness, difficulty in breathing, pounding. We used to call it palpitation. So that pounding sensation in your chest can also be a problem. Irregular breathing is also one of them. Chest pain, you know, blood in urine is a really bad one, okay? So we don't want to wait for you to get, you know, to that point. So those are the basic symptoms. Well, like we said, don't wait until you get to that point. Please, after our talk today, make sure you have yourself checked, okay? And I think that should help all of us. If you've not gotten anything from here, please have your blood pressure checked. I would give you a marker of 130/90, because anything above 130/90, you have to really be careful, okay? But 140/90 for sure. If you, like Dr. Atupele said, after 3 consecutive checks, maybe you go to the hospital every month, and after 3 consecutive checks, it is always 140/90. You want to have something done about that. So I don't know if our speakers are back. Okay, yes, I can unmute you now. Dr. Akinlade, I see you. You had an issue with your connection.
Hello.
Hello.
Yes, I had an issue with network on my laptop, so I had to come back to my phone.
Oh, sorry about that. Thank you so much for logging back in promptly. Okay, actually, all right. So we are back in. They've asked several questions actually. And we just went through them. Looking at the time now. Okay, welcome back, Doc.
Sorry, also network problems on my end.
It's really amazing how both of you went off at the same time.
Was it at the same time?
Oh, honestly, it was like, what happened? But anyway, we are good to go. Without further ado, I think we should swiftly move on to the next topic, stress management. Thank you so much, Dr. Atupele. That was wonderful. Of course, if you have more questions, we can also treat them at the end. So keep your questions coming if you still have questions on hypertension, but we'll be moving swiftly along to the next topic, which is stress management. And I'm looking forward to that one because that is a tool that we all need this tool, honestly. So Dr. Akinkunmi is going to be taking that topic. Dr. Akinkunmi Akinlade is in Ogun State, okay? And he is the MD of King Central Hospital. Okay, King's Central Hospital, Ogun State. And you'll be taking the topic stress management. Are you there, sir?
Yes, I'm here. Can you hear me?
I can hear you perfectly. There's a rebound, though, a little rebound on your.
Yeah, I'm so sorry about that. My laptop went off, so I may not be able to share my slides, but I will try as much as possible to carry everyone along.
Okay.
Can
If
you all hear
another
me?
device close to you with a volume, put that volume off so that there's no rebound.
Yeah. Is there still a rebound?
No, not okay. You're good now.
All right. Thank you very much, everyone. And thank you very much, Dr. Atupele, for that wonderful discussion. So I hope that everyone can hear me and see what I'm talking about. So today we'll be talking about stress management. In the changing times when with COVID and all the stressful things we have in the world now, this is the better time to learn about stress management. And in the next few minutes, I'll try as much as possible to carry everyone along with this. Sorry once again that I can't share my slides. I had a lot of issues that came up within just 1 minute. Anyway, so that's another stress, and I hope I'll be able to manage the stress right now. First, there's a quote by a man called Reynold Neighbor. He said, "God grants me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference." Okay, at this point in time, one of the things that make people stressed or that stresses people is not being able to distinguish between the things they can change and the things they cannot change, and the wisdom to know the difference between both of them. So we'll try as much as possible to help you to be able to understand stress, to be able to see how you can manage it, and how to also help other people who are going through stressful conditions at this moment. So I'll be talking about what stress is. I'll talk about the symptoms of stress, the management, and I'll conclude. And in case you have one or two questions you want to ask me, you can go ahead and ask. First, what is stress? Stress is the pressure that is experienced by a person in response to life's demands. Okay, some of us have some tension, some strain, pressure from a situation that requires us to use, adapt, or developing new coping skills. When you worry that you cannot cope about a situation of life, that means you are stressed. And like someone says, it calls stress a wear and tear experienced by the body and mind while coping with the continuously changing environment. We have a lot of changes happening in the world now, and in the process of these changes, you have to also adapt. The process of adapting can bring a stressful condition to you, and that is why we need to understand this topic. Stress is not all negative. We have positive stress, we have negative stress. Okay, when we all hear about stress, what we're all thinking about is, so how can I cope? How can I manage my stress? We all think about it in terms of the negatives. But sometimes it can also be positive. For example, you're preparing for an exam and you need some level of stress to be able to deal with the exam. You need some level of adrenaline, you need some level of hormones pumping you up to be able to have to read over the night. Okay, so stress is not all negative. We can have some positive stress, but I want us to understand that what this topic is about is to know how to deal with the negative stress of life. We all pass through stressful conditions, and I'll be talking a lot of things that can be stress for us. But the problem comes when the pressure of life is more than the resources we have available to cope with the stress, with the pressure. Let me come again with that. Stress results when P is greater than R, where P is pressure and R is the resistance or the resources we have to be able to deal with the stress. Okay, so the old situation or the old management of stress is when we are able to balance the pressure with the resistance. It is the problem with imbalance that leads a lot of people to stress. Now, our body responds to stress, and that is why we must talk about the stress response. When you're stressed, you have something worrying you, you have something you're thinking about, it activates the endocrine system, what we call the hormonal system in the body. And this endocrine system fires up adrenaline and noradrenaline, dopamine. A lot of hormones are released that begins to affect you and begin to produce a lot of symptoms in your body that can make you sick, that can make you feel anxious, that can make you feel tired, okay? And these are the ways by which the body responds to stress. Another way by which the body responds to stress is through the general adaptation syndrome. What do I mean by that? There is an alarm response that is produced by the body that increases the hormones that make you react to stress, that gives you the sleeplessness when you have when you're stressed, that gives you the tiredness, the fatigue, the dizziness that you usually experience when you are stressed. There's also the adaptation phase. At this phase, what happens is that the body begins to develop mechanisms to cope with stress. When the adaptation phase fails, that is when we now have the exhaustion phase. At this phase, what happens is that the body is just exhausted. And that is why a lot of us come down with the negative symptoms of stress. There are things that we need to define. Two of them, stressors. There are two types of stressors. Things that trigger stress in people. We have external stressors and we have internal stressors. Under the external stressors, we talk about the things outside an individual that makes the individual to be stressed. For example, physical, it could be social, it could be organizational, it could be life events, and it could be daily activities of life. For example, it could be that you are living in an environment where there is a lot of noise or a lot of bright light, or it could be that in your workplace, the boss is more demanding, or in your academics, you have to cover a lot of topics. Or it could be that it could just be daily activities of life. All these have been shown to increase the stress level in people. The other stressors is what we call the internal stressors. These are things that come from within. For example, lifestyle choices. People that don't exercise, or people that smoke a lot or take a lot of alcohol, people that take caffeine, people that have a lot of negative self-talks. They are always pessimistic. I don't think I'm good enough. I don't think I'm smart enough. I don't think I can cope with the pressures of life. So all these, or people who have mind traps, people who have defeatist mentality, they just see the negatives in everything. They just think that they don't know how they're going to cope. They have negative self-talk. All these are internal factors or internal things that could result in stressors. There are some with some personality traits. For example, narcissists who always think that the world must revolve around them, or people who are perfectionists. They want to do everything the right or the correct way. They don't want anything to be wrong. They just want to dot their I's and cross their T's. All these people, or with this kind of tendencies, can have a lot of stress, and they must learn how to deal with this stress. What are the symptoms of stress? What are the things that we see in people who are constantly not able to handle their negative stress? I'll talk about them under physical symptoms. I'll talk about mental symptoms. It could be behavioral and it could be emotional. Under the physical symptoms, you just discover that you are unnecessarily fatigued. You sleep well over the night, you wake up, you're tired. You have problems with digestion. You can have dizziness. There could be insomnia. You're not sleeping well, or you couldn't get to sleep. There could be changes in sleep pattern. We could have headaches. Just have this low-grade headache. You can't explain it. You have body pains and aches. You can faint, sweating and trembling. There could be tingling sensations on your hands and your legs. You just discover that you have some burning sensations on your hands and legs, or palpitations, what we call fluttering sensation in your chest. All these are physical symptoms that could suggest that someone is going through a stressful condition. We could also have mental symptoms like memory lapses. You just begin to forget things. You lack concentration at work. You couldn't concentrate in your studies. You couldn't concentrate at work. You could have difficulty in making decisions. You're just there. You don't know what to do. You could be confused, or there could be panic attacks. You just have this feeling of border of death, like something terrible is going to happen to one. These are some mental symptoms of stress. It could also be behavioral, like I mentioned, and some of the behavioral symptoms are changes in appetite. You're not eating well. People's stress can go into alcoholism, and they could go into using recreational drugs. We could have smoking, restlessness. There could be nail biting. There could be fidgeting, and there could be hypochondriasis. That's just fear of sickness or illness that they don't even have. They just get unnecessarily anxious about medical conditions that they don't have. Emotional symptoms of stress, depression, they have low mood, they have loss of interest in previously pleasurable activity, they could have loss of energy drive, they just don't want to do anything, they have this feeling of guilt, feeling of hopelessness, they could go into anger, unnecessary anger. Sometimes they could even be tearful, just be crying. Why are you crying? I don't know, I'm stressed. They don't take time to take care of their appearance and their personal hygiene. All these are some of the emotional symptoms of stress. Aside the symptoms that we have talked about, there are also some medical conditions that are worsened by stress. A couple of days ago, I saw a patient with asthma, and he told me that he only has symptoms anytime he's in Nigeria. I don't know, maybe Nigeria is more stressful than the US or UK. I don't know about that. But yeah, he's able to give me that. He was able to give me that symptom because he has noticed it over time. And that is because stress can actually be worsened by some medical conditions can actually be worsened by stress. For example, asthma, like I mentioned, diabetes could be worsened by stress, ulcers, psoriasis, people with premenstrual syndrome, depression, digestive problems, cardiovascular, a lot of heart diseases can also be worsened by stress. Don't forget that health is not just the absence of disease, it's a complete thing. Social, physical, mental, psychological well-being, and not just absence of diseases. So stress has an effect on our medical conditions, and a lot of medical conditions are worsened by stress. If you're following me so far, it's now time to talk about stress management. I had to go through that just for us to have a baseline knowledge about what stress is and how to, we should know what stress is and how to characterize them and categorize them. So, but what matters most is how can I manage stress, doctor? I have a lot of issues happening to me. I have a lot of things that are wrong with me. My marriage is about crashing. My academics is suffering. I have a lot of things and I don't know how to handle it. Now, I must give you good news. And the good news is that stress management is as simple as A, B, C. What is the A? I'll talk about the ABC strategy. Awareness. You want to be aware of what is causing you stress. What is responsible for your stress? You must be able to answer that question before you can solve the problem. If you don't identify the problem, there's no way we can solve the problem. So what causes me stress and how do I react to it? That is what brings you some level of awareness to how you can handle or how you can manage your stress level. That's the first thing we need to know. That's the A of ABC. The B is balance. How much can I cope with? A lot of us go through a lot of activities or we take on too many responsibilities than we can handle. And that's why we break down. But when we understand our limit, we understand that beyond this point, I cannot cope, then it helps us in being able to deal with our stress level or being able to manage our stress. So how much can you cope with? That is the B of the ABC strategy. And the C is control. What can you do to combat the negative effects of stress? What is within your power as a person to combat the negative effects of stress? So these are some of the strategies. Number one that we've talked about is awareness. You must be aware. You must know what is causing you stress and how you are going to react to it. Very important. Then you must have a balance. What can you cope with? Beyond which level will you take responsibilities, or beyond which level will you take things, after which you will not go down that lane again? And C is control. What can you do to combat the negative effects of stress? Now I'll talk about the techniques that we can use to deal with stress. Don't forget that many of the things that we talk about is in the mind. We're talking about what is happening in our minds as people. And it is our thoughts that leads to our actions. So if we can deal with our thoughts, if we can handle our thoughts well, we can handle our behaviors, and then we can handle our lifestyle. And that is the only way we can reduce stress in our lives. So the first thing to do, or the first technique I will be talking about today, is changing your thinking. If you are able to change your thinking, you will be able to change your behavior. if you are able to change your behavior, you will be able to change your lifestyle, and definitely you'll be able to handle stress much more. Now, how do you change your thinking? The first thing you need to understand is what we call reframing. What reframing means is that you begin to look at things not as they are, but as you interpret them. For example, it's just like the proverbial cup of water that is not full. Some see it as half empty, and some other people see it as half full. It's all about perspective. So you need to begin to see things the way you want to see it, and not the way those things are. For example, if you have an exam you're writing, some will see that exam. Someone is not prepared for the exam. Somebody will see that lack of preparation as a reason to get prepared. And you see this person reading hard, studying hard to pass that exam. Some other person that is not prepared to will say, I'm not prepared for this exam, so I don't think I can do anything about it. So the person sleeps and then, gets relaxed and won't do anything about it. The same situation, but different response. So for you to be able to change your thinking, you must reframe your mind. You must reframe. Start seeing things. Don't interpret things based on how they are, but how you see them. The number two about changing your thinking is positive thinking. There's a popular adage. It says, as you think in your heart, so are you. This is not to make you build castle in the air, but just to give you some perspective about life. There are challenges in life. There are things that would happen to individuals in life, but you need to consciously develop an attitude of positivity. You have to see strengths. You have to see opportunities. You have to see possibilities. Oh, I may not be there yet, but I will be there. I may not be prepared for this exam the way I thought I could, but I could still try. I could still do something. What are the possibilities I have in my mind? So these are the things you need to begin to consciously cultivate in your mind, reframing and positive thinking. Then another way to handle stress is by your behavior. We need to change your behavior, the way you act, the way you do things. For example, a lot of us are not assertive. Assertiveness is one skill that if we can develop will help us to totally overcome stress. We don't know when to say no. We just say yes to almost everything. Can you do this work for me? Yes, I will do it. Can you come online now? Yes, I will do it. All these are things that definitely increase the level of stress that we go through as people. So you must begin to change your behavior by getting more assertive, by developing good assertive skills, by understanding that you deserve to say yes and you also deserve to say no, by understanding that you are entitled to the basic rights that everybody else is entitled to, and that you deserve to be happy, you deserve to be free, and you deserve to make the most of yourself. Okay, so basically, it is assertiveness. Another behavior that we need to also incorporate is getting organized. A lot of us are not organized. We just put everything together. We should develop good organizational skills that will allow us to know what to do at what time, when to do it, why to do it, and how to do it. Okay, we should also have good time management skills. These are the behaviors that I believe that when we begin to consciously incorporate them into our lives, is going to help us to reduce stress drastically by having good time management. Know what to do, when to do it, how to do it. In addition to this, we should also know what not to do and why not to do it. You can't do everything. You can't spread yourself too thin. You're not all there. You don't have all the time. You don't have all the energy. So you have to try as much as possible to focus and choose what to focus on and what not to focus on. Another way to reduce stress in terms of behavior is what we call ventilation. There's a common saying that a problem shared is half solved. We have to try as much as possible to talk to people, find trustworthy people that you can discuss with or you can talk with. You don't have to carry the burden on your own. There are counselors, there are psychologists, there are psychiatrists that could help you in getting better and in making you pour out your mind so that stress can be drastically reduced in your life. Another thing we can do is to get a diary. It's been advised you could get a diary, just write a lot of things there. What is coming to your mind, write it in the diary, pour your minds in the diary and don't read diary again, okay? It's just a way of you ventilating and easing out the stressful condition that you're passing through. Another behavior we can incorporate to reduce stress is what we call humor. Humor is the best medicine. Laughter is good for the soul. You can see I'm laughing, even though I'm under a stressful condition now. The network went bad. My laptop was not showing again. A lot of things came up, but you still have to come up with humor. You have to come up with some laughter about life. Don't take yourself too seriously. Don't carry the world's burden on your head. The world is not going to crash on you. So you must learn to laugh. Laughter has been proven to reduce blood pressure. It has been proven that it also releases the tightened muscles in your body. It increases the number of endorphins and enkephalins, or what I call good hormones, happiness hormones. It releases them in your body and definitely will allow you to focus and do what you need to do at the proper time. So I think there's one thing you should take away from today is that laughter helps to reduce stress, and a good sense of humor reduces stress. I know a lot of you are wondering that with a lot of challenges we have in Nigeria, how come Nigerians are happy people? I think I know one reason why Nigerians are happy people. We are very humorous. We listen to a lot of humor. There are lots of comedians from Nigeria. And that is why I believe we are able to cope with the myriads of challenges we face in this part of the world. Obam, can you hear me?
Yes, we can hear you perfectly.
All right. Thank you very much. So humor is good for the soul, it's good for the body, and I believe that we should develop a good sense of humor. Don't take yourself too seriously. Another thing we can do, or another behavior we can begin to incorporate to reduce stress is what we call diversion and distraction. Sometimes you have to take time off. What may be stressing you, you have to take some time off to focus on something entirely different that would distract you from that thing that you are passing through. Okay, for example, you've been at work, you've been working all year, working. All work and no play makes Jack a dull boy. All work and no play makes doctor what do you call it now? A stressed doctor, makes a lawyer a stressed lawyer. So take time off to relax. Take time off to focus on something entirely different that will take your attention away from the activity that is causing you stress. Okay, now we'll talk about lifestyle. And we've talked about changing your thinking. Don't forget, we've talked about changing your thinking. We've talked about changing your behavior. And now we'll talk about changing your lifestyle. And your lifestyle can affect your stress. Number one way to change your lifestyle is in terms of diets. A lot of us are not even aware that our diets can increase the level of stress in our body. You eat unbalanced diet, you just eat any kind of food that you can lay your hand on. That is not good for our body. So when we begin to take a lot of fruits and vegetables, we take a lot of water, all this will keep us rehydrated and reduce the level of stress in the body. We also want to quit smoking, and if it's possible, stop taking alcohol or reduce it to the barest minimum. Okay, all these have been proven to reduce the level of stress in our body and our minds. Another thing we should learn to add to our diary is exercise. Exercise is wonderful. It's good for the soul. When you exercise, it helps release good hormones into your body, and it also helps you to release stress. 2 or 3 times in a week, I'm sure, will definitely not be bad. A lot of us also need to sleep more. Sleep rejuvenates the body. When you sleep well, you wake up strong, you wake up well, you wake up with gusto, with enthusiasm, with energy, and you are able to carry on with your daily activity. So sleep is very good and has been proven to reduce the level of stress. Leisure too, like I mentioned earlier on, taking leisure, taking some distraction away from work will also allow you to come back to work more fired to be able to deliver. A relaxation is also a lifestyle that many of us need to adopt. You can't work and not rest. Your body is not a machine. And even the machine also takes time to rest. How much more you? So you need to schedule regular time to rest, to relax, to make yourself comfortable. And when you do this regularly, I'm sure that you'll be able to take care of yourself and reduce the level of stress in your body. So summarily, I've talked about 3 ways by which you can handle your stress: by changing your thinking, by changing your behavior, and by changing your lifestyle. As I conclude, I bring again the quote by Reinhold Niebuhr. He said, "God grants me the serenity to accept the things I cannot change." Some of you cannot change something. There's no need worrying about them. the courage to change the things that I can, and the wisdom to know the difference. Once again, thank you very much for being a good audience.
Wow, that was simply amazing. Thank you so much. I managed to put some of the information down. I hope you can all see it. That was both informative, very light. I mean, I'm sure our stress was even relieved by the way that you put that presentation. Thank you so much. Well, I'm sure you are seeing some of the questions that we have on. Please, guys, I tried as much as possible to put the information on the chat as well, so you can go there to refer to them. I just want to quickly scroll up and see some questions that we have here. So thank you so much, Miriam. Miriam has been helping us with collating the questions. So thank you so much for doing that. Oh, wow. The first question is just, I mean, it's delicious to my ear. Can stress be spiritual? Thank you, Dr. Akinkunmi. We had to go there. So can stress be spiritual? That's the first question.
Okay, thank you very much for the question. Well, anything that alters your mind, that affects your mind, that gives you anxiety, remember the symptoms I talked about, anything that gives you anxiety, that gives you fear, that gives you pressure, definitely, no matter what, from what source it comes from, can be a source of stress. So if your source of stress is coming from a spiritual, in quotes, angle, then I think that, yes, stress can be spiritual in origin. For example, a couple of people come and say God is punishing them for their sins, and they're having some challenges in life because they are suffering from sins. I don't want to go into spirituality, but yes, stress can be spiritual. I believe it can be spiritual.
Yeah,
yes.
Because, you know, it's relative to different people, all faiths respected. You know, health is both physical, mental, spiritual. So if the person is having something that is burdensome to them, and of course, it's going to affect your health also, based on the hormones that Dr. Akinkunmi just mentioned. So definitely, we can see where that relationship can come in. The second question is, how can I reduce or entirely avoid stress? Entirely avoid stress.
Okay, I wish it's possible for us to entirely avoid stress. Don't forget, I mentioned that stress can either be positive or negative.
Right.
So if you want to entirely avoid stress, that means you want to also avoid the positive aspect of stress. It's not possible. You need stress to function in life. You need stress to prepare for an exam. You need stress to do your daily activity, the positive ones, okay? But when you are not able to balance, when you are not able to correctly balance your life with the stressors, that is when there is problem. So I think the question should be like, how can I reduce stress? Or how can I manage stress? And we've mentioned a lot of things we can do by understanding the triggers. What are the things that cause your stress? You must be aware. Remember the ABC. You must be aware of what is causing your stress. If it is work, if it is you are doing something you don't love, or whatever you think, or an uncooperative spouse, anything that is causing your stress, you need to find out what is causing that stress. You need to find a balance, and you need to look at yourself and see a way you can control the stress or you can reduce the stress. So awareness, balance, and control are key factors in reducing our stress.
Fantastic. Now, can your finance cause stress? I think that question should be thrown open to everybody on this. Can your finance cause stress? Go ahead, doctor.
Of course, that is an unequivocal yes. Yes, finance is even a major cause of stress for a lot of people. I saw someone yesterday that was stressed, you know, a patient crying, tearful, and in the course of our discussion, I found out that 99% of our cry, of our problem will actually be solved if there was money, if there was finance. So yes, finance is a major cause of stress, and that's why we must try as much as possible to learn financial management, good financial management, not to go beyond what we can afford, and to make sure that we have good budgeting skills. in our archives. So yes, finance can be a cause of stress.
So he actually qualified it and said he noticed that, I'm just assuming it's a he noticed that they have money. When they don't have money, they get stressed out and angry. So definitely from all the skills that we've taught today, you'll be able to manage that. And it's something that resonates with most people, okay? So it's not a peculiar thing, I don't think. When I don't have money, I'm angry. So we can totally relate to what you're saying. The fourth one is, how can a pregnant woman control their stress? Okay, that's a good one.
Oh, thank you very much for that wonderful question. Pregnancy itself is a trigger for stress, or could be a trigger for stress for several reasons, especially for someone who is just getting pregnant for the first time. The expectation, the mental expectation, the stress, the fatigue, you know, a lot of things can happen in the course of pregnancy. And that is why a pregnant woman will have to be extra cautious in controlling stress. What can you do? The first thing I would advise is to ensure that you book your pregnancy in a good hospital. Okay, when you are in contact with your physician, with your doctor, it helps you because you will have a lot of information. You know what to do at every point in time in the course of your pregnancy. The doctor carries you along with what is happening. So that will definitely reduce your stress level. Another thing you can do is to engage in regular, appropriate exercises for pregnant women that they can do. There are several exercises that pregnant women can do that will help you to relieve stress. You can also discuss with your partner. You know, your partner can also help you in reducing the level of stress by being more attentive, by helping you with house chores or with home chores, by being a listening ear, by going with you to the hospital for your medical checkups or for your antenatal clinics. All these are ways by which a pregnant woman can reduce the level of stress that they have. You can also belong to a support group. There are many pregnant women around you, or that you can talk to, that will tell you how they feel, how they are able to deal with their own pregnancies. There are a lot of applications online too. I can't remember the name of the application now, but there are lots of applications for pregnant women online that they can, you know, read articles. They can read a lot of news on it that will calm them and give them right information about their pregnancies. So there are several options available for a pregnant woman.
Absolutely. Thank you so much. That was a very, and thank you so much for that question, because whoever asked that question, because it's very, very vital. And another question here is, can stress affect your sex life?
I was expecting that.
Oh.
Okay, yes, definitely. Don't forget that sex is not just physical. Stress is also psychological on both male and female. To have sex, for a female to enjoy sex, definitely it starts from the brain. For male to enjoy sex, yeah, it also has some brain components in it. So a male that is stressed, no work, no money, have a lot of responsibilities, there's no way he's going to have libido. And even if he has libido, it's going to affect his performance. Okay, a lot of males that are stressed have performance anxiety. For example, they want to do this for a woman, they think they want to satisfy their partner, and in that process, they get stressed and they get anxious, and they have what we call performance anxiety, and that will definitely compound their stress. For a woman who has some other issues, financial issues, marriage issues, family issues, definitely she doesn't want to have sex. And so it is very important for us to take stress management very seriously, because it doesn't just affect our sex life, it affects every area of our lives, including our health. So yes, stress affects our sex lives.
Thank you so much for that. Absolutely, that is so true. We have more questions talking about what the red flags are that tells you are stressed out. Dr. Akinkunmi mentioned a lot of them actually, which I've written on the chat. If you can go through them: the physical symptoms, dizziness, poor sleep, sweating, trembling; mental symptoms, difficulty in making decisions and panic attacks; behavioral symptoms like being alcoholic and smoking; psychological symptoms like low mood, being tearful, and lack of personal care; and medical symptoms too can worsen stress, like diabetes and psoriasis and a lot more. Is there anything you'd like to add to that, Dr. Akinlade?
Yes, thank you very much for that question. Red flags. Yes, there are red flags. Aside the many symptoms I've mentioned, when you begin to know that you are having consistent low mood, you just feel low. On a scale of 1 to 10, your mood is around 2, 3, very bad. Or you are having loss of energy. You just don't want to stand up from the bed. You just want to sleep all day. You don't want to do the thing. Or you are losing interest in activities that were previously pleasurable to you. You are having thoughts of guilt, overwhelming guilt. You are feeling hopeless and worthless. Or you are having the thought of ending it all. You want to kill yourself because you can't cope with stress. These are red flags. Suicide is a red flag for stress. Severe depression is a red flag. You are beginning to hear voices that other people around you cannot hear. You are beginning to see people that other people around you cannot see. These are red flags for stress. And immediately you begin to see these red flags, you need help. Okay, so you need help by seeing a medical practitioner that will guide you in the right direction. There are other things that that the moderator has also mentioned.
Yeah.
Yes.
Thank you so much. This response that you've given actually feeds into 2 more questions on the list. I'm sure everybody is looking at, we're doing very well with time, so we'll be wrapping up shortly. And the question says, can stress cause mental problems like hallucinations? And you just mentioned them, which feeds into the next question, which says, what is the relationship between stress and depression? Okay, so can you tie those 2 questions together?
Oh, thank you. Let me look for an example. Stress, don't forget, if you are not able to cope, or if one is not able to cope with activities of daily living, you cannot cope with the things that are happening to you, you are stressed. Stress occurs when pressure is greater than the resources available to cope with the pressure. Now, what is depression? Depression is when you have 3 major symptoms: low mood, loss of low energy drive, and loss of interest in activities that were pleasurable to you, and some other symptoms. Now, of course, if you are stressed, you don't want to do anything. You just think life is over for you. Just think, how can I cope with all these things? I think I should just end it all. So there is a direct relationship between stress and depression. In fact, they are brothers and sisters, if I can just say that. Okay. So that is why I mentioned earlier on that depression is a red flag for stress. So you discover that you are feeling guilty. You are feeling, for example, you can feel guilty when you don't know how to say no. You've not developed your assertiveness skills. You just say yes to everybody. And so when you are not able to fulfill the things that you said yes to, of course, you start feeling guilty. You start feeling low mood. You start feeling low energy. You start feeling worthless. You start feeling hopeless. You start losing libido. Your libido gets low. You have anhedonia. You have a lot of symptoms that begins to affect you, and that will lead you to depression. And that is why we must ensure we learn how to take care of our stress.
Thank you so much. Absolutely, absolutely. Thank you so much. I'm sure people on this call have really, really gained a lot from your responses and today's talk. Just a final question. Sometimes anxiety builds up a lot of mental stress that could lead to shortness of breath and in some cases fainting. How best could this be managed? That's by Idris Lawal.
Oh, thank you very much for that question. Anxiety disorders can also result from stress, like I mentioned earlier on. And on the spectrum of anxiety disorder, there's what we call panic attacks. I mentioned it the other time. I think the symptoms is mentioning closely resembles panic attack, where you feel like you are going to die. You start, the breathing is not working well. One feels like one can't breathe. One is going to die. Overwhelming feeling of death. And this is also a sign or a predictor of ongoing stress or chronic stress that has not been properly managed by a person. If one is having frequent panic attacks, it's an indication that one needs help. Let me use Nigeria as point of focus now. A lot of people don't understand that mental health is very important. So they just think that they go to hospital only when they have malaria, typhoid, and have hypertension and diabetes. No, mental health is also one reason why you should go to the hospital. So when you are beginning to have recurrent episodes of panic attacks, shortness of breath, fainting, dizziness, excessive sweating, fluttering sensation in your chest, what we call palpitations, you're beginning to have this recurrent, then you need help. We have what we call talking therapy, cognitive behavioral therapy, that will help you in managing it. And aside that, if it's getting so worse, we have some medications that we can start you on, that when you begin to take those medications, it will reduce the incidence of panic attacks that you have. So someone with recurrent panic attacks should definitely seek medical help.
Absolutely. So we have, I think there's one more. Okay, just an acknowledgement. Someone was like, too much money gives you stress, lack of it gives you stress as well. So you choose your stress carefully. So that was by Mr. John Akinkunmi. And there's a final question here. I think that will be it. And please, if you are in somebody was asking about the slides. So please, for us to have good correspondence with you, you can put your email in the chat right now. When you put your email in the chat, we'll be able to send you materials as well. Somebody was asking about the slides that we didn't get to see. So that can also be arranged, I believe, by the director of this platform. So the final one was talking about differentiating anxiety and weak erection during sex. I don't know how that ties into the topic, Dr. Akinlade.
I think this person is talking about performance anxiety. What happens in anxiety is, especially performance anxiety, is that the person wants to do very well, perform very well. And in that process, the person is filled with a lot of stress. Don't forget, stress is tension. So the person has a lot of tension, a lot of pressure, the pressure to perform. So in the midst of that pressure to perform, the person will not perform. So the person may have weak erection, the person may have premature ejaculation, and then that will form a form of a loop that will now, the person is thinking, I can't perform, I hope I can perform, I hope I can try. That creates stress in the brain. And because of that, the person goes ahead, the person will not be cool, there won't be calmness, so the person will have weak erection, there will be premature ejaculation, and that will now create another loop back to confirm the belief of that person that the person cannot perform. So that's what we call performance anxiety, and it's one of the major causes of erectile dysfunction and premature ejaculation in young people. So the best way to deal with it is to learn to deal with your stress level. There's no need to put yourself under unnecessary tension to perform. If you have an understanding partner, just enjoy yourself, enjoy the process, enjoy the procedure. You don't have to please anybody. Make sure you are happy, make sure the person is also happy, and I can assure you that you will do much more than when you're trying to stress yourself with performance anxiety.
Thank you so much. That is such, you've done so well. I want to say a big thank you to our speakers who have been here. I don't know, I think I'm getting a feedback from somewhere. Okay, thank you so much, Dr. Akinlade. We have an applause coming in for you. That was very, very beautiful, articulate, and I love the way you address the questions. I want to also say a big thank you to Dr. Atupele, if she's still here. But to do the appreciation and to round off this discourse, I want to thank everybody that has been on the call. My name is Dr. Okay, I'm a medical media personality, also a medical doctor. I'm very passionate about public health and health awareness. I'll be handing over to our coordinator for SDG3 Global Health, Dr. Miriam
Hi, good
Ofoegbu.
afternoon, everyone. Can you hear me?
Yes, we can hear you. I wish we could
Thank
see you.
Thank you so much for everyone who tuned in today, listening to our conversation on hypertension and stress management. It means a lot to us that you all are here, and we hope that you continue to join us in our future presentations. On May 22nd, we have another workshop coming up. It's focused on mental awareness and just sharing information about how to deal with mental issues. You don't really have to have, people don't really have to have mental issues to be part of the group. It's just a way to help you maintain sanity, given that a lot of things are going on around the world right now with COVID, people losing their jobs and everything. So please be sure to join us next on May 22nd for our presentation on mental awareness. And I hope everyone have a wonderful weekend. And I think that'll be it for today.
Awesome. So thank you all so much for being here. That's a wrap. Please, we hope to see you on our next session. And you can also follow the social media platform as well at SDG3 GLOBAL HEALth, okay? That's on Instagram. You can also check the website as well. So thank you all. Thank you to all our speakers. Thank you, Dr. Noblin, Ngozi, Ogbonna. That is the founder and director of SDG3 Global. So thank you so much, guys. We'll see you same time at another session. Thank you, Miriam. Bye.
Bye.
Remember to put your email on the chat, please, so that we get that record and send more information to you. Thank you, Dr. Akinlade. Thank you, Atupele.